Thank you so much. Okay, great. So anyway, I'm zooming in from a cabin in California that was rebuilt 12 years ago after a wildfire burned it, and 14,000 acres in the surrounding area, Point Reyes National Seashore. So you can understand the climate change has affected me personally. And, while I'm in the privileged position of having a home and resources, having experienced the actual power and wildness of wildfire, some of you may have as well, I'm not sure, or other kinds of climate disasters. But having experienced that has been deeply embedded in my body. So during this presentation, I'll be trying to stay connected to my somatic experience, because I think that's really important as we talk about this. And I'll encourage you to do that too by taking a breath every once in a while. But the precarity of nature, has been deeply embedded here. And from that, I've learned so much that psychological resilience has to do with self-care. So I encourage you all, to take care of yourself during this time with me, this 50 minutes. Sit back and breathe, try to stay engaged, but do whatever you need to tend to your own bodies and minds. I'll be presenting from a clinical psychology perspective on the climate crisis, considering not only the factual impact of global warming on mental health of various populations, but also the ways in which mental health clinicians and healthcare workers, I know that many of you are nurses or students or people in healthcare professions, with a few therapists, I think, zooming in from, different parts of Montana. So in general, we can learn to work with these big emotions and build psychological resilience as a group. And behavioral science includes the study of how we transform behaviors and beliefs about our own influence on this, how we change from the inside out. And we can with respect to sustainable behaviors and encouraging that in our patients. I know, let's see, that, as I said, most of you today are healthcare students and professionals and nurses. So I hope my presentation will land with you in terms of helping build awareness of the emotional side of your patients, which I'm sure you experience all of the time and have your own ways of working with. But it's a slightly different thing as we begin to cope with climate change. It can be a really tough topic, but as Dr. Patel mentioned this morning, in addition to understanding what we're dealing with in terms of the facts and the impacts of the health impacts of global warming, it really helps with our own burnout to stay focused on imagining a world where there is justice and beauty and clean vistas and health for our families and communities. It's that sense of imagination, I think, that drives us forward. I have to put this slide up, just means that I don't have any financial relationship with anyone here to disclose. So here's what I'm going to cover in the next 45 minutes or so, and then we'll have time for some discussion. The first thing is I'm going to describe mental health impacts of climate change on various populations, including some in Montana. I did a little research on that, and the amplifying impact of the climate crisis on at-risk populations and those with comorbid psychiatric disorders or those with pre-existing psychological disorders of various kinds. Dr. Patel this morning mentioned that this was, I tuned in for that presentation, it was great. She mentioned that this is a problem of health inequity, and it definitely is a problem of mental health inequity as well. Those who have more resources and access to behavioral health do better. The second thing I'm going to do is define some key principles of this emerging field of climate psychology and the field's attention to the inequitable impact of climate change on all of these different populations, social, racial, regional, all of that. And the third thing is I want to describe some common emotional responses and defenses and behaviors that accompany climate crisis awareness, which kind of interfere with our ability to do anything about it. And so those are really important to understand: minimizing, compartmentalizing, dissociating, projecting blame onto other groups. Those are normal kind of psychological defenses, but they get in the way of us actually doing anything about the problem as a group. And also, they're not engaged just with the climate situation as we know, but they're amplified and strengthened because of the complexity and the uncertainty of, this increasing level of threat that we're hearing about in the media all the time, and which is probably true, right? So let's start with the impact of climate change on mental health. And by the way, I can't monitor the chat. So if there's something urgent that comes up, if someone can pick up the phone and just give me a little cue, that would be great. All right. So generally, when we think of the mental health impact of climate change, we divide them into three different categories: direct, indirect, and vicarious. Most research has focused on the direct impacts of climate change on mental health, which are those that happen after experiencing an extreme weather event, or a seismic event like what happened just in Turkey 2 weeks ago, and which we're seeing on the news quite a bit. But generally, these events that we've been kind of measuring mental health after are floods and fires or hurricanes. The mental health after effects of Hurricane Katrina in 2005 is among the better studied climate catastrophes. And 18 years later, we know that not only what going through the hurricane itself was incredibly traumatizing, the after effects in the breakdown of services, these are the things that happened as a consequence of the hurricane in the days after, the breakdown in public services, homelessness, shelter violence, and displacement led to a lot of PTSD, depressive disorders and anxiety disorders, substance use disorders, and suicidality, all of which measurably increased after the hurricane. I have family that who lived in New Orleans and continue to live in New Orleans. And, so I visited New Orleans quite a bit. And, you can still, it's still there in the kind of mental health kind of piece of that area. Or Lake Charles, somebody else mentioned that this morning as well, which is very close to New Orleans. Which has had multiple kind of assaults on its environment. Even being in an adjacent community or a neighborhood can contribute to the emergence of what might otherwise have been subthreshold symptoms, like symptoms that haven't yet come to the surface. In a little while, if I have time, I'll tell you about a child I treated after one of the California wildfires whose family didn't lose their home, but the stress of the situation caused the emergence of OCD, obsessive compulsive symptoms in this 8-year-old girl. In a related way, like the Katrina example I just talked about, indirect impacts of climate change also affect mental health through the consequences on the economy, migration, damage to physical and social infrastructure, food and water shortages. All of those are linked to increased levels of mental health problems, like increased perceived stress, increased grief over losses, anxiety, and depression. However, even without experiencing direct or indirect effects of climate change, many feel distress simply by being aware of the global environmental crisis. One indirect response can be anticipatory, like things haven't happened yet. I look out my window, it looks beautiful today, right? But in reading about it or becoming, aware of it through the media or, whatever other source, we can begin to experience this anticipatory, or what my colleague Lisa Van Sesternen calls termed many years ago, pre-traumatic stress disorder. So, those are some of the indirect ways of experiencing climate change and vicarious ways of experiencing climate change that impact our mental health. So in terms of the acute and chronic mental health impacts of extreme weather events, so let me just take a step back. When I'm talking today, I'm talking about kind of two aspects of climate change, right? There's the immediate disaster impacts of climate-related disasters, and then there's the long-term and chronic sort of psychic burden that we're dealing with, especially in our young people, when we consider it. So in terms of the acute and chronic mental health impacts of extreme weather events, the list here on the right side of the slide are all things that have been measured. And I've highlighted a few of these in yellow, just because these are the ones that really stand out, not because the other ones are important. Depression and increased suicidality and suicide, increased levels of anxiety, substance abuse goes up. Of course, anybody want to drink after a hurricane? but sometimes that turns into a chronic issue, aggression and violence, and then the compounded stress from all of the above, plus feeling, a sense of helplessness or fear or fatalism about the future. I'm not going to go too much into the impacts of these areas because I know our speakers this morning really covered them pretty deeply in terms of the physical kind of impact of heat and air pollution and vector-borne and infectious and vector-borne diseases and the psychological burdens of worry over time. But just wanted to kind of point out a couple of the mental health pieces that they didn't, kind of have time to cover. From higher temperatures, we know that interpersonal violence increases on hotter days, as does suicide. So, there are specific groups that are vulnerable to the effects of extreme hot temperatures. And these people are people with pre-existing mental health conditions. Of course, anybody with a pre-existing physical health condition or elderly or young, children, are also, kind of impacted more differentially with respect to heat. But, when you're on when you have a psychological disturbance and you're on a medication, maybe a psychotropic medication, the risk of dying during hot periods is really increased just due to the medication impacts and kind of interactions. So with air pollution, we've known since the 1970s that high levels of air pollution cause, all kinds of harm and asthma, cardiovascular problems, respiratory health problems. But the effect of air pollution on cognition, like our ability to think and our mental well-being, has been less well understood. And now we know that evidence is mounting that dirty air is bad for our brains as well. So over the past decade, researchers in the United States, Europe, India have found that high levels of pollution may damage children's cognitive abilities permanently and increase adults' level of cognitive decline and possibly contribute to depression. Smoggy days obviously don't feel good, right? I know that you in the Rockies, especially if you're in the western part of your state, like I was in, just west of the Tetons in my time over the past 3 years, that's summer before last. We hardly saw a clear day from the fires in California drifting over the Great Plains. And it's depressing, right? Can't go out, can't do the usual things that you like to do in nature. And then, of course, with infectious and vector-borne diseases, they're rising, of course. The incidence of what we're finding epigenetically is that, of course, schizophrenia and depression, anxiety are all genetically linked, but, there are also precipitants in the environment that catalyze these. And infectious diseases is one of those catalysts that are, kind of creating more of those kinds of genetically linked kinds of psychiatric problems. I'm going to go into the psychological burdens of worry over time throughout this presentation. But, we're seeing an increasing rate of demoralization among our youth around the future, stress of living with uncertainty, and the perceived loss of control that goes with that. These are impacts that are only growing, as the climate becomes more precarious. So a lot of words on this. I'll just talk you through it. There are two brand new studies that just came out in the last month that I wanted to share with you all about the impact of wildfire on cognitive functioning and on psychiatric symptoms. This area is so new that we don't have a lot of, great measures. There's some self-report stuff, there's, clinicians reporting what they're hearing in their offices, but these are two studies that, have some great, they're peer-reviewed sort of reports. The UCSD study is the first to use EEG, brainwave measurement and neurocognitive tasks to measure attention, working memory, and this thing called interference control. So I was a neuropsychologist for most of my career at UC Berkeley and at UCSF, and I used to work primarily with ADHD and learning disabilities. And so we would use these tasks of what we call executive functioning. Executive functioning is that part of the brain that resides in the prefrontal cortex that helps us with decision making, attention, focus. It helps us with, being able to stay focused on a task in the face of distractors. So stuff is going on around you, but you can still do, your work. And that's what interference control is. Let's see. They compared 3 groups in this study. They compared people who had actually gone through a wildfire, I believe it was a camp wildfire in Northern California, who directly had impacts from that and PTSD from that. And then they compared them with some people who were in the indirect group. So remember those 3 groups: indirect, direct, and vicarious. So they basically compared these 3 groups. The indirect group was in a neighboring place that didn't actually endure the wildfire. And then the 3rd group was in San Diego in Southern California. They age matched them. They matched them on SES, socioeconomic status, and a number of other factors. So they were fairly, similar in terms of all the background variables. So there were no differences among the 3 groups on working memory, like the ability to kind of encode information for short-term use. And there were no differences in terms of direct attention, where they found EEGs, and the EEGs were also unremarkable among those groups. So among the between the tasks that they were actually having them do, these computer-based, sort of attentional tasks, and then had them hooked up to EEGs at the same time, the EEGs were similarly unremarkable for those variables, right? However, and this is an important finding, that lets us know that the brain and the attentional system is impacted by exposure to wildfire. The EEGs and the interference control variables, like that task that they were doing where they had to stay focused in the midst of distractors, were different for the wildfire survivors. And, this is stuff that's sort of, like, what would you call that? Common sense, right? Like, you've gone through a wildfire, you're probably going to have some PTSD. That's probably going to interfere with your ability to pay attention, right? Especially when you're, there's a busy environment going over. But these are the first studies that had actually measured that. So I thought it was worthwhile bringing up today. So the other study from Yale this week had a lot of very important findings as well, and I can't go through all of them. There were many parts that they, kind of reported that have implications for behavioral health. But what I thought relevant to this group has to do with the question of how many people actually, report in therapy or want to report in therapy that climate distress is a problem for them, because this is a question I'm asked all the time. Like, do people actually have this problem? Do they actually talk about it in therapy? So you can see there that 8% of the general population, this is a general population, either talks with a therapist about climate change or they want to. So 8% is not a big number, but in the general population, that's actually quite a significant finding. And then on standardized measures of anxiety and depression, these are, ones that we use routinely in assessment, not just self-report kinds of, instruments. These have been validated across many populations and across countries, show higher levels of both with, people in the general population these days with regard to climate change. Yet 63% say they never or rarely talk about it. So, this is a big problem. As Dr. Patel said this morning, there's a lot we can do to help people with talking about climate change and validating their concerns and staying engaged in positive conversations about it. That's part of our work, right? Hold on just a second. All right. So for the past few minutes, I've been talking about general impacts of climate change. And the presenters this morning mentioned, climate change is worse for these populations. They were talking more in terms of physical health, the mental health implications for these populations of women, children, the elderly, people of color, indigenous population, poor people, those who live in hot places in our world, are all, similarly, really impacted by or disadvantagedly impacted by or disproportionately impacted by climate change in terms of mental health let me just take the first two groups. So, although climate change is a collective problem, its burdens, including displacement, homelessness, poverty, sexual violence, disease, they weigh more heavily on women and children. So that, that's something to think about. For people of color and indigenous populations, due to the legacy of colonization, racism, economic disadvantage, they live more frequently in areas that will be impacted by climate disasters, or they've been historically traumatized. And as the lands they live on are increasingly damaged, they're, by climate change, there's a deeper kind of trauma, like the loss of a homeland that they've already experienced before. This is all, kind of within what we need to be thinking about in terms of climate justice. So how is global warming impacting the mental health of Montanans? So I was reading up on Montana's approach to climate change, and no surprise that a couple of the authors of this report, Climate Change and Human Health in Montana, a special report of the Montana Climate Assessment, are with us today. It has a mental health section. The bottom line, and I'm certainly oversimplifying it, is that this set of studies indicate that it's going to get hotter in Montana, and lower SES or socioeconomic status is going to be a risk factor in the decline of Montana's people's health in both the physical and the psychological sense. You might recognize this picture down by the gate of Yellowstone there in Livingston. This is Livingston, Montana, one of the main places that flooded when the Yellowstone River overflowed its banks back in June of last year, caused massive damage to the towns in the vicinity. I was still living in Wyoming at the time. We saw this close up, but it knocked out the northern entrance to the park, making tourism, a major source of income for people in that area, go to zero during the summer months and beyond. And while Yellowstone has flooded before, most recently the river has flooded before, most recently in 1996. Weather scientists agree that there have been more what they call rain on snow events, or the combination of heavy rain combined with fast kind of snow melt in the past decade. And there will be more as warmer temperatures bring unusually potent storms, those things that we call atmospheric rivers. They used to be called pineapple expresses, to higher elevations like the Rockies and the Andes at times of the year when there's still considerable snow on the ground. So the Tetons, where I lived, are seeing decreasing glaciers. I know you in Montana are as well. I read, we know that Glacier National Park will outlive its name, will outlive its glaciers. And what does this mean for mental health, right? One doesn't have to use too much imagination here to understand that just alone losing 6 months of income in Livingston or in other areas around there means a lot of stress. Not to mention the displacement and disruption in thinking, like how we, like that interference control, and daily function and family functioning will be. So I want to take a look at a study that was done in 2020 on the impact of farmers and impact of climate change on farmers and ranchers in Montana. So this was a self-report study. Farmers and ranchers, they know more about weather and seasonal changes than most of us. I know they work the land, they see the impact of drought and soil depletion, and also the water rights tension, that we know about more than others. 72% agree that climate change is having an adverse effect on their farm and ranch. 75% of ranchers and farmers in Montana said they felt anxiety about the effects of climate change. And then the greater the person, this is normal, in any kind of a stressful situation, but the greater the reported perceived risk regarding climate change, the greater level of the anxiety. So that's a normal finding. And it should be said that the impact of climate change on farm and ranch profitability was the main kind of cause of stress for this group. I believe that there were probably some indicators of, their feelings about conservation or nature, but, when you're losing your land and losing your ability to make a living, that's where the stress was. So kind of having, talked a little bit about the mental health impacts on us, I want to talk about the emotions that arise when our patients come in with feelings about climate change. I'm just going to start with some language that we're starting to pop up, that's starting to pop up quite a bit in, at least in the behavioral sciences and psychological circles, but, important for all healthcare workers to kind of have a handle on what it is that people are feeling, right? So we know climate anxiety and climate distress has been in the press a lot in reference to, kind of what people feel. In 2017, the American Psychological Association defined climate anxiety as a chronic fear of environmental doom. So what does that mean? A chronic fear of environmental doom. I think what that means is being overly concerned about the environment, right? And a general feeling of helplessness in knowing how to fix it or feeling like our leaders are going to be able to do something about it. Eco grief, that's the grief that we feel in relation to experienced or anticipated ecological losses. That sort of rides in the background for a lot of us. We're not quite aware of it, but sometimes it's just this feeling of like, oh, I just can't really enjoy what I used to enjoy in nature, knowing that it's going to go away. Solastalgia is related to that. The pain or distress caused by the loss of a comforting place, the sense of desolation people feel consciously or unconsciously when their home or land is lost. I can say something about that personally. A lot of people have witnessed this in California through wildfire. So when this place burned 25 years ago, I lost my home here in Point Reyes, and it was heartbreaking to see the after effects. And it really does just look just like those pictures you see in the paper of, kind of burned and blackened trees and burned out buildings. But I lived on that land. And I just want to say, this is a shared experience of many people who've lost their homes in disasters. I gardened in it. My cats had their little paths in the forest, and, we knew that land intimately, and this land here. And when it goes through that kind of heat, it never comes back exactly the same way. So there is a beautiful forest here once again. It's 25 years old. But that old forest was different. It was, had old growth, Doug firs, cypresses, oaks, big trees, what they call heritage trees. And now, one or two of those remain, but the forest is really thick with too many small trees fighting for sunshine and resources. So it's impossible to walk through it now because of the density. So, and also I need to say, it's once again a campfire waiting to break loose. There's a lot of tinder out there now again. So when it gets hot here again, we live through 4 months of, wondering when the next fire is going to happen here, because it will. Pre-traumatic stress disorder, I mentioned that earlier. Topoversion. So this is the feeling that you do not wish to return to a place you once loved and enjoyed when it's been irrevocably changed for the worse. So a lot of people, more than half of the neighbors that I have here, of the 54 who lost their homes, fewer than half returned. Existential dread, of climate change. And a lot of us have existential dread about a lot of things, including our own existence, right? But this is of climate change. And then ecological anger and outrage, which we're seeing a lot in our youth populations. So just want to climate feelings are different than other kinds of feelings. Oopsie, sorry about that. Oh, yep. I recorded that earlier just to see what that was like, to see how I sounded. Okay, so climate feelings are different, right? They're different than other kinds of feelings. They're compounded, meaning, like if we have pre-existing trauma, they kind of mix in and amplify and magnify those feelings. They often contain mixed emotional responses, not one feeling all at once. I know I have that. Like when we think of our children, especially, it's a mix of grief and love. sometimes anger and hope, sometimes sadness and fear, sometimes more than two feelings. So these are the kinds of emotions that arise with the uncertainty that we're all facing. And then sustained emotional responses. And I'm really saying all of this not to, scare you or overburden you, but just to kind of give you some framework in which to see your own feelings, our own feelings, and the feelings of our patients, right? So sustained emotional responses means that usually in therapy, we're looking for closure around a situation. So if somebody comes in with a specific problem or marital conflict of some kind, I'm looking for closure, right? And we used to live in a world where, we'd have a fire and then it would end. But now we live in a world where there's ongoing dread of fire season or hurricane season. And what used to be 100-year floods are probably going to be starting to occur every few years. We can adapt to all of this, and I will get to that in a minute, but in a few minutes, but just wanted to go through this first. So the big question, and this is kind of good news here, do our feelings about climate change pose a threat to our mental health? Does knowing about it, does exposure in the media, all that kind of stuff that we're worried about actually threaten our mental health? And one of the lead experts in this kind of field of psychology and climate change is Susan Clayton at Worcester University. And she says, for the most part, no, that's good news. What she says is that our feelings about climate change can generate psychopathology, meaning kind of behavioral health issues, if we don't have a support network, if we're already feeling ineffective, like we have a low sense of efficacy in the world, like we don't know what we're doing in the world, haven't found a path, don't feel a locus of control. Of course, pre-existing mental health problems, kind of make us more vulnerable. Or if we live in an area that's vulnerable to, ongoing climate disasters. Or the last one I want to say is, and I've seen this in my own office quite a bit, is if we're thinking about having children. 4 in 10 women, and now they know that 4 in 10 men also feel this, of childbearing age, report feeling ambivalent now about having a child because of the way that the world is kind of dealing with climate change and experiencing it. I think I'm going to skip these vignettes in the interest of time. I had a couple of, these are not their real names, but I had a couple of cases that I wanted to talk with you about. Maybe I'll talk about Cassidy. She's the 8-year-old I mentioned before. So she came in for treatment for problems paying attention in school. So I was an ADHD expert in my prior career, and increased separation at night. She couldn't go to bed without having her mom in bed with her. And then she had checking behaviors. So checking behaviors are like having to check over and over again, like, are the doors locked? Are they really locked? Because, the voice of the OCD says, well, maybe you forgot to lock them, go back and check again. So that's what a checking behavior is. And then, and her parents said that, so they went through a wildfire in a neighborhood in 2017 next to them. So they didn't lose their home, but it was like 5 streets over, and several people who they knew lost their homes. So that was the precipitant, right? So prior to that, her parents said that she'd been a pretty typically developing girl. Now, she probably did have subthreshold OCD before this happened, but, all of a sudden, the OCD really took hold. Like, they could not go to bed. Like these checking behaviors would last an hour sometimes, going back over and over again. So that's when they knew that they needed some psychotherapy. Also, the attentional problems at school. Teachers were reporting that she was having, more trouble staying with the class. She was in 2nd grade at the time. So her vulnerabilities were, a pre-existing diagnosis of OCD. Actually, she didn't have a pre-existing diagnosis. She had pre-existing kind of sub-threshold symptoms. Like, her parents knew that it was hard to get out of the house sometimes because she'd want to go back and check the lock, but it wasn't like it was taking a half an hour. They live in a wildfire affected area. They do have good support networks. So that was one thing in her, like, her parents were super supportive. They lived in a place where there were many trusted adults around for her, aunts and uncles. But they did live, I already said that. And she had a pretty good locus of control for an 8-year-old. Like, in terms of development, we think of what can an 8-year-old control, within their household and her relationships. There was not, kind of too much kind of out of control for her. So prior to the wildfire. So, in terms of her treatment, it was a fairly, wasn't a lengthy treatment. Basically, I worked with her on, some of the internal voices that would come up that would tell her that it wasn't safe. And we'd go into what we call talk back strategies and learned about that and made that kind of fun, did some play therapy around it, and also had her parents go with her and check the areas around the house to make sure that they were fire safe. And in time, they were able to ramp it back down, and she started to be able to sleep by herself again and, kind of do the normal things that normal 8-year-olds do. Climate psychology. So I know that you're not psychologists in the room, but I just wanted to alert you that there's a whole new field that's developing here around climate change. So I want to kind of switch gears now, just a minute, take a breath and talk about treatment, new ways of thinking about helping people in the consultation room. And this not only applies to therapists, but to people working in all kinds of healthcare settings. So kind of listen with your own lens on that. So climate change, I put a little formula here, equals climate change knowledge plus psychological principles and processes, the kind of things that I'm trained in and the other therapists in the room are trained in, and then plus systemic, social, racial, economic inequity understanding, right? So that's what this field is sort of understanding how climate change, what the science of climate change is, how we can apply our behavioral health and psychological principles and do this with an understanding of the overarching systemic problems that we're dealing with. And the second thing is climate change aims to apply understanding of psychological processes that occur in response to climate change. So those are like, what I was talking about before, sort of like how it is that, different people in different populations respond to climate change. And I'll talk a little bit more about defenses in a minute. And its effects, and to nurture psychological resilience among people suffering from, kind of the more destructive impacts of climate anxiety. So in sum, it's concerned with how we feel about the climate emergency and what we can do about it. So I consider myself a climate aware or climate informed therapist. So when a client talks about their climate fears with me, I'm on the alert for pre-existing or sub-threshold psychiatric conditions that might amplify or be exacerbated by news about global warming. But on the whole, I and my colleagues are trained to see climate distress as a rational response. So let's see. It's a rational response to climate stress brought on by a real threat. Okay, that's real. The distress itself is not the malady. Climate change is the problem, okay? And the systemic impact of how humans have organized our living structures are the maladies, so just wanted to be clear that that's sort of how we approach this, right? Now, we treat people who have climate distress, and there are modes of treatment that I'll talk about in a minute. But the problem is not the person, it's what's going on in the world. So let's see, underlying premises. Premise number one, climate crisis is real and urgent. And we believe the climate scientists, and we know that disruptions of the Earth's ecosystems are at root a human behavior problem. So there's technology involved here, right? There are economics involved here. There's social systems and cultural systems that are involved in how we got here, right? But all of these, the underlying substrate is human behavior and how we think about things and how we organize ourselves socially. Premise two, so psychology has a lot to, kind of contribute here in terms of helping. Psychology provides potent tools and safe spaces for understanding what within ourselves, and in our society and culture leads to unsustainable or to sustainable living. And the third premise is that, and this is really important, for all of us healthcare providers, compassion and empathic listening are the keys for unlocking our creativity and motivation and the will to bring us back into alignment with the Earth systems. So what do I mean by that? I just mean that it's sort of like talking about suicide with somebody who's suicidal, right? And maybe this isn't an apt analogy, but I'll just take it for a minute because it came to mind. Everybody thinks it's, like in their families, like, don't talk about it, don't ask them, right? How do you think that makes somebody feel when they're never asked about it or their feelings aren't validated? Of course, you had to do something about it if they say, yes, I'm suicidal, right? It's the same kind of premise here. It's sort of like if we don't talk about it when somebody's actually feeling it, those 64% of people who said that they couldn't talk about it with people, the isolation itself is really just depressing. So it's okay to bring the topic up and talk about it. We have to feel regulated ourselves when we do it. So don't do it if you feel disturbed by it and you feel like you're going to be pulled right into it. But, it's days like today, right, where you get more used to talking about it. You hear about it. You feel more comfortable with the topic. That help. A few misconceptions that I hear about climate-informed therapy. So the object of climate-informed therapy is, like I just said, is not to stop you from feeling emotion. Climate therapy won't automatically eradicate those fears just by talking about them either, but it helps. It helps you develop a way to relate to the feelings so that our intelligence can be freed up to move into an empowered stance with regard to the climate crisis. So you know how it feels like, when you're holding something, maybe with your spouse or your kids, and you haven't talked about it and you think it's really hard to talk about, and then you talk about it and it's fine. It's the same here. I'm going to take a minute and just talk about assessment. I know I'm getting up to the 40-minute mark here, so I'm going to move through this just quickly and say all of these words on the screen mean that there are validated measures of climate anxiety that we're beginning to use when we do assessment with our patients. This is one by Susan Clayton and her colleague in 2020. It's been validated in many, many parts of the world, and it basically gets to how anxious am I? And then on the next page, how effective do I feel in response to that? Like, I recycle, I turn off lights, that sort of thing. Because those things, even if you do one of them, actually on a regular basis, make us feel better. All right, let's talk a little bit about defenses. Again, a lot of words on the page here. But, all I say is that we need these defenses, right? There's threat out there of some kind. We need to be able to mediate it, not only physically by getting away from it, but also by having these ingenious strategies to kind of put it aside, right? So denial, disavowal means like these people sitting here on the sofa, like, I know there's something going on out there, but I'd rather just snuggle up on the sofa here and not think about it. That's disavowal. We do that all the time. I do that all the time. Other kinds of things, the avoidance is the major one, fight or flight, basically, diversionary activity, gaming all night long, whatever, not to feel, shifting responsibility to other people. And then we have, more positive coping styles. And these are what we try to kind of encourage, right? Ecologically adaptive coping styles. So seeking information, but only when it's not overwhelming. So it's okay to read about this, but it's not okay to doom scroll all day long, right? And then become depressed. I would say connecting with nature for me and most people that I know really helps quite a lot. So that's one of the reasons we want to protect nature. Some other things. So I'm going to talk a little bit more about therapy in a minute, but so we'll get back to that. I know I went through that pretty quickly, but in the interest of time, I want to talk about young people a little bit. They're feeling it more is the bottom line. An international study by Caroline Hickman and her colleagues at Yale published in The Lancet last year, a report on 10,000 young people in 10 countries spanning the northern and southern hemispheres between the ages of 16 and 24. 83% of them say people have failed to take care of the planet. 48% reported negative impacts on daily functioning, like eating and sleeping and concentrating, school, work, relationships. Of course, the levels of distress were higher in countries more affected by climate change. And over half felt anxious, powerless, sad, afraid, guilty, and angry. That's a lot to take in. So again, what can adults do? What can we do as healthcare providers? We can let them know that we're a safe place to talk about it. They're not alone. Adults are doing things. They don't have to take this all on by themselves. And if they're interested, provide opportunities or thoughts about how they might, or inquire with them about how they might want to take action to, like somebody said earlier, registering to vote is one of the most important things to do. People under 18 can't do that, but they might get involved in their school environmental program. Those are the kinds of things that really help mental health. I can show a little picture of my kids here because Dr. Patel showed her very adorable kids earlier. One of the main reasons I do this is for my kids, Emma and Ryder. So Emma's there cross-country skiing with me on the left, and that's a very sweet picture of Ryder. Emma's a remote worker with an Icon ski pass. She's in Jackson right now, so you can imagine what she's up to today. And Ryder's a third-year doctoral student studying genetics close by to me at UCSF. They're both doing well professionally and personally. It's really gratifying, and I'm happy for them. They have the usual ups and downs of young adulthood. But that generation of theirs has been really caught between looking towards a future that seemed limitless when they were young, and more recently realizing that the economics of owning a home, having children, and understanding the impermanence, the beauty of nature, which we kind of help them love, might be uncertain as they age. So there's a vulnerability here in our young adults, and I just wanted to kind of put them up there because they're the closest ones to me, and so they are where I feel this impact the most. I'm going to skip this slide. It's a video of what kids are feeling. But let's get to clinical services for the climate distressed patient. I've touched on it a little bit already, but I want to kind of go back into it again. You can read this slide a little bit. It says at the bottom, if you can't read it, if it's too small, would you worry less about your relationship if I told you we're about to get hit by a giant asteroid? So I can chuckle about that, but there's some reality to that, right? I mean, that's our paradigm in individual and group therapy and couples therapy has been like life satisfaction, right? So that, it's starting to shift a little bit is all I can say, towards maybe there are these more global issues like racism, systemic racism, and, climate change and its impacts. I mentioned how therapists approach this work with climate distress. There are a few nuances here that I just wanted to cover quickly, like how is climate crisis different than other existential threats? So, like when I was young in the 80s, it was the nuclear threat, right? Or the pandemic, that's another existential threat. But climate change is different. It doesn't hit just one part. It can't be solved by a treaty. Well, it might be actually solved by some treaty in the future. Who knows? But it's a little different than nuclear war, which kind of we don't know what that would be like. We've only seen a little bit of that in the last century. The pandemic was something that we could possibly mostly solve. I know you're healthcare workers and you probably see a lot more of it than I do, but it seems like, the vaccines and, people's behaviors, kind of helped get that down at least by half. But that's not the case with climate change. The second point are demoralization, apathy, anger, and sadness clinical symptoms. They can be. We've talked about that a little bit, possibly, right? Is there compound? One of the questions we need to ask when we're treating our climate distress clients is there compounded trauma or existing victimization? So I guess what I mean by this is it applies to people who've already been harmed, by intergenerational colonization, genocide, enslavement. Or are they living with violence currently in their lives? Are they, suffering a lack of power due to their migrant status, race, gender, things to consider. So the clinician, us, has to step outside our usual paradigms when we're talking about this with people. And here's my prescription. You don't have to do this if you don't want to, but I think we have to model talking about the topic with ease, which means that we have to be somewhat at ease with it. So it means learning how to deal with this ourselves, right? And have colleagues and friends that we can get support from. Psychoeducation in this is important. So what I mean by that is letting people know that their feelings are normal, sensitive responses to a threat, and that there's a developmental arc to their feelings, starting with an initial fear and urgency, and that can calm down as one, kind of learns more about solutions and intelligent people are working on it. They're not alone, that sort of thing. And then this last one's probably the trickiest area for us clinicians is self-disclosure, right? I've long thought that self-disclosure probably wasn't a good idea. It didn't serve my patients, right? But I think it's somewhat permissible in this work in a guarded way. And this represents a paradigm shift, discussing and admitting our own attachment to the natural world, our stance as climate activists. I'm a climate activist just by doing this work, right? The problems of traditional psychotherapy have long been centered on individual life satisfaction, like I just said, but there are frankly bigger issues going on. So I think in this case, self-disclosure, at least for me, is permissible. Youth therapy allows for expression of intergenerational anger. I'm 63. I have to really take a pounding sometimes from my younger clients who say it was your generation, right? And it was. We knew, right? We didn't know how bad, but we knew. So we have to be able to kind of be the voice of understanding in that. Also, I just wanted to say something about environmental science education. So I was looking for videos to use in this presentation, and I came across some conservative news takes on youth and their feelings about climate. And they're pretty convinced that it's because they're getting educated about it in their science classes and it's making them anxious. And that may be the case in some ways, but I don't think that that's actually what's going on. But the thing I think that we're missing is that students and young people also need the emotional support when they're talking about these issues or being educated about them in the classroom. And a lot of science teachers don't have that kind of training and background. And we need to provide that. At the Climate Psychology Alliance, which I'm really heavily involved in, we're trying to create curricula for teachers around the emotional support of this topic. So these issues of environment don't exist in a vacuum. We see that not only is the threat to our personal survival a topic for our clients, but also issues of fairness, human suffering, inequitable distribution of resources, including healthcare. And there are ways to address these, but they take deeper work for all of us. And I want to thank you all for being here today and actually taking a look at this. It's not an easy topic. And I know signing up for a class like today, see the yellow, that's the 5 minutes. Okay, I will be done in 5 minutes. Thank you. Thank you for coming, to doing this, because this actually is what it takes, is for all of us to get educated about this topic. Couple minutes on how we can prevent and manage mental health impacts of climate change. So at the community level, and I stole this from the report that some people in the room, produced, the Climate Change and Mental Health in Montana report. So, and I put this one in after Dr. Shank spoke this morning about decarbonizing our workspaces and community spaces as much as possible. That's really great. We need to plan for increased mental health impacts of climate change. That's what we're doing today. You guys are all working together to do that. Inform healthcare providers. That's also what's going on today in public about the mental health impacts, not just the physical impacts of extreme weather events, poor air quality, rising heat, flooding, drought. And then at the individual level, it's not letting me go to my next slide. So, encourage breaks. If somebody comes in and said they're overwhelmed, tell them not to watch that news anymore. Overexposure can be a real problem. direct them back to time in nature or however they like to get their tanks refilled, right? Also, I'd like to confront the belief that we're too small to make a difference. I believe that each person, if they do one thing, is important because that leads to the next thing. And then maybe somebody else will see you doing that one thing and be inspired. So one thing is, a difference, right? Talk about the complicity and guilt. We're all part of the system, right? I have 72 degrees going on right now in my house. It's comfortable, right? But it's using heat. I'm complicit, right? But this is a systemic problem. It's not ours alone. I'm not going to go through the other ones, but you get the gist. There are therapy resources. There is a climate aware therapist directory. I looked this morning and there are at least five climate aware therapists in Montana, 4 of them in Missoula. One of them, I believe, is in Bozeman, maybe someplace else. You can go to the websites for these 2 groups, the Climate Psychology Alliance of North America. I'm not just a shill for the Climate Psychology of North America. They actually do have really, really good resources, as does our sister organization, the Climate Psychiatry Alliance. The thing that I want to end on today is this case. It's an incredibly unique case in your state of Montana. You may know about it. You may have provided expert testimony for it, for all I know. Held versus the state of Montana. This is Ricky Held. She's a college student from Billings, Montana. She was in high school when she became a plaintiff in a youth-led climate case called Held versus the state of Montana. So it turns out that your state has extremely robust environmental rights and protections written right into the Constitution. And so for the first time, and this has been tried many times, believe me already, in many states and in Europe and many different high courts, it's the first time in US history that a US-led climate change lawsuit is going to go to trial. It's going to be in June in your state. They've disallowed the mental health impacts on the children. There are 16 plaintiffs because they said that the physical toll of climate change is enough testimony. I think it's because they want to weaken the case, but that's my own paranoid thought about that. But it's going to go forward. And last week there was a threat to it. The state tried to get it to, kind of go away again. And the court said, no, we're going to hear this case. So it's ongoing. And now you can look it up, Held versus the state of Montana. Good luck. So ending on this quote, I've given you a lot of, kind of difficult information, I think. I hope I've given you some thought that there are people out there in the behavioral sciences and psychology who are really looking at how to, sort of leverage maybe these skills that we have into change at the community level. I like this quote from Karen O'Brien at the University of Oslo. It's important to recognize that there's not one solution to climate change. It has to happen at all levels. Each of us has a circle of influence. You're in my circle of influence, right? We are all agents of change, and we can create an alternative future. I believe that. Here's some references for you. And I'm going to stop the share so we have some Q&A time. Somebody's falling from where you guys are, right? Hold on. All right, thanks a lot, you guys, for bearing with that. I was saying that I live in a coastal area now in California where the values, of course, are more liberal. It was great for me to live in Wyoming. I lived in the little blue dot of Jackson, but, quite aware of living in a red state, how values really come into conflict politically. There have been some great studies done on this in terms of the kind of arc of communication that can happen between polarized groups. And all I can say is that there's probably 25% of people who you'll never reach through communication because their tribe is the most important kind of area, the most important influence that they have. So I think the question was, about sort of the polarizing impact of climate change and definitely it's, for whatever reason, probably media and politics, it's become a politicized issue, right? And we have to do our best to kind of take it out of that domain, because it's really a scientific issue, as we all know. And try to deal with it more at that level. Katharine Hayhoe has written a great book on this. She's a climate psychologist. She's also a board member of the Nature Conservancy, and she's a conservative Christian. And her book is called Saving Us. So you might check out her work on this, about having climate conversations where you can find shared values. So I practice this quite a bit. I had in my neighborhood some oil executives, and I really practiced a little bit with listening and finding the place where we actually both had some shared values, like the love of the natural spaces, the migration corridor that was nearby, where the wildlife migrated. So I'm not sure if that addresses the question, but it is possible to kind of settle those nerves down that have become polarized. Oh, okay, Lisa, I just want to read did you ever all see what Lisa wrote in the chat? I'd be derelict in my duties as a board member of our Children's Trust if I didn't mention that they are the ones working. Yes, of course, Children's Trust has been working with many of these cases. Sorry about that, Lisa. If you'd like to support their work, she's got a website there, the www.allchildrenstrust.org. Thanks, Lisa. My colleague, Lisa Van Susterna, has worked quite a bit with our Children's Trust as well. And we were on the phone yesterday talking just about this. Yeah, thanks for that question. I mean, this is an immediate question that we talk about at the climate psychology level, at the Alliance at the executive level quite a bit, is how to scale up, because it's true, especially in the face of disasters, that there are not nearly enough mental health clinicians. And before disasters occur, not many people really want to collaborate on the mental health challenges. They want to collaborate around sort of getting together about exit routes and the more physical challenges, but frequently people don't think about the mental health kind of pieces. So those pieces oftentimes are not in place, especially after disaster. So we're doing work, Bob Doppelt, who's done a lot of work on community resilience, talks about building these circles of, resilience, essentially, where we begin to reach out to other first responder organizations. And so we are doing that, of course, at the Climate Psychology Alliance, to try to build supports like at the YMCA or, in schools, so that these resources are immediately available, but they're not right now. And they're going to be needed quite a bit more in the future in terms of teaching people about adaptation and, adaptation to climate change, essentially. I'm not sure if that gets to the full question, but this is something that we have to kind of break out of our existing paradigms of being in a consultation room with a single person and bringing psychological principles, behavioral principles, health principles to the general community. And how do we reach into those communities is really the question that we're struggling with, but making some headway with at the same time. So I always say, by the way, people will start to change when they get hot or they get wet in a flood, right? They're not going to change until, not going to change theoretically because, climate change might be happening, right? And that is a perfect example of how this is occurring. Like there was trauma there, and then people kind of surrounded this trauma with some supports, right? They developed their high school activism work. They felt alone in that. And then you're bringing it to a larger level. So I love that. And that is exactly what the mental health piece of this can really be improved with, is that kind of social support. Yeah, that definitely helps. So the second vignette that I was going to share with you today was exactly about a case that I worked with a couple in the central kind of part of California. She was a newly minted resident in family medicine, and her husband worked in a different industry, and they were really struggling with this feeling of wanting to have a child, but really one of them did, and the other one felt like the world is just not a safe place. And, you know, my stance on this, I'll just say personally, is that people shouldn't stop having children because of, you know, possible calamities that haven't happened yet, right? Now, we all have to know that the world's going to be a really different place in 40 years than it is right now. But is it going to be a place that's unlivable? None of us know that. We're all dealing with that uncertainty, right? And this is a very personal choice that people have to make. I would suggest that I have heard people say, well, we'll just train our kids to be the ones who are going to solve the problem. I've heard that from several couples, and I would stay away from that kind of reasoning, right? If you're going to have a child, you're going to have a child because you want to have a child. And so in terms of the declining sperm count, you know, obviously that's going to be an issue, right? The environmental factors that are, you know, making that happen are going to get worse. And so, you know, people who are more exposed to environmental disasters and pollution are going to have more problems having kids. I'm not sure what I can say to solve that problem. All I can say is to speak to the issue of childbearing is such a personal choice. And my own daughter said to me recently, she's not in a relationship right now, but she's 27. I know you'd like me to have kids, like thinking that I'd want to be a grandmother, right? And I would have 20 years ago. And but I don't try to tell her one way or the other, you know, what her choices are. And I don't do that with my young people in I open the space for them to explore it. I validate their concerns, and people are going to do what they're going to do, right? Most people, when they're of childbearing age, and as they get towards the end of childbearing age and feel more pressure around that decision, are probably going to do what they did, you know, 20 years ago anyway. Reproduction is a hugely potent force, right? So anyway, that's my experience with it. It was entirely my pleasure. Yeah. Bye-bye, everybody.